Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the systemic lupus, okay, fine. In the systemic lupus erythematosus, we have um, systemic lupus erythematosus and the complement levels. So, if you see systemic lupus erythematosus and complement, actually in SLE, the complement levels are reduced. Com complement levels are actually reduced in SLE. So, C3 is reduced in SLE. So these complement reduction in complements will correlate with the disease activity of the patient. It will correlate with the disease activity. That means the levels will fall on acute exacerbation. On acute exacerbation, the complement levels will be decreased.
thank you and thank you for watching.